HighBridge, a division of Recorded Books, presents Type 2 Diabetes for Beginners, 2nd edition, by Phyllis, MS. Read by Coleen Marlo. Forward, by Barbara Anderson. When we read a book, we read within the lines and between the lines. Within the lines means that we pay attention to what the author has written, to the printed facts and to the information. Between the lines refers to both the emotional tone in which the facts and information are given, as well as the information that the author has not included. Type 2 Diabetes for Beginners, which has been written by a seasoned nutritionist with substantial diabetes experience, has the comprehensive information and facts within its lines, from carb counting to stress management, that a person needs in order to begin and maintain a life with diabetes. However, what is most unique about this book is that it also communicates between the lines, providing the essential emotional message that it takes determination, courage, and support to maintain the stamina to sustain this journey in living with diabetes. The experienced nutritionist who wrote Type 2 Diabetes for Beginners is also an experienced clinician and has worked for years with individuals with diabetes and their families. Phyllis understands that what patients and families need does not simply end at the information and facts, but also requires energy, optimism, and engagement to successfully apply diabetes facts and create and continue healthy lifestyle changes. As to information that is not included in this book, you will find no mention of how easy it is to live with diabetes. You will not find misleading messages that say you can do it all yourself. In fact, you are assured that living with diabetes is a difficult challenge and that everyone on the road needs two teams, an experienced healthcare team and a family friend support team. What I appreciate most about this book is its honest and reassuring tone. Within the lines and between them, the person with diabetes is guided to take small and realistic steps to create and continue needed lifestyle changes. And as Phyllis has said so strongly within and between the lines, building a long and healthy life with diabetes can be a realistic long-term goal for everyone with diabetes. Barbara Anderson, Ph.D., Professor Pediatric Endocrinology and Metabolism, Baylor College of Medicine, Houston, Texas. By Martha M. Funnell. I am honored to introduce this book and congratulate you on taking this important step in caring for your diabetes. If you are like many of the people whom I see as a diabetes educator, and you just found out that you have type 2 diabetes, you are probably feeling somewhat overwhelmed. You may also be feeling angry, scared, or confused. You probably also have questions. You may have concerns about taking care of a chronic illness such as diabetes. And you may have discovered that diabetes is different from other illnesses you have had. Having diabetes means that there are many decisions to be made each day about how you care for yourself. Making wise choices will make a difference in both how you feel today and your future health. You may also want to begin to make some changes in your life that will help you take better care of yourself and your diabetes. As much as you truly want to make these changes, it is never easy, especially when it comes to how you eat, handle stress, and exercise. It may help to know that you are not alone. This book is written to be a resource to help you learn how to manage and cope with diabetes. You may not know a lot about diabetes yet, but you do know about yourself and what is important to you. When you combine what you know with what your healthcare team knows about diabetes, you'll have a powerful combination. I often tell my patients that diabetes is a journey. It is probably not a journey that you would have chosen, and it is not an easy one. But even the hardest journey is made easier when you can lighten your load. This book can be a guide for you. The more you know, the more you will feel that you are in charge of diabetes, rather than allowing diabetes to control you. You can also learn how to make decisions that are right for you, and to make changes in your life so that you not only live long, but live well. Best wishes on your journey. Martha M. Funnell, MS, RN, CDE, Michigan Diabetes Research and Training Center, Ann Arbor, Michigan. Introduction. Diabetes has been part of my life for many years. You see, diabetes is in my family. My Aunt Carla has had diabetes for as long as I can remember. My cousin Pam has had diabetes for a number of years. Other cousins have now been diagnosed with prediabetes or type 2 diabetes. I guess you can say that diabetes runs in my family. My mom has type 2 diabetes too. A number of my high school friends now have type 2 diabetes. Many people I love have diabetes. Many people you love probably have prediabetes or type 2 diabetes too. And you or a family member or friend may have been told you have prediabetes or type 2 diabetes. Since writing the first edition of this book 5 years ago, my circle of family, friends, colleagues, and neighbors with prediabetes or type 2 diabetes has grown substantially. You see, diabetes is an epidemic in our country. Close to 2 million adults are diagnosed with diabetes each year. As a registered dietitian, RD, I worked for 30 years with people who have diabetes. I was a certified diabetes educator, CDE, for 20 years. A CDE is a healthcare provider who specializes in diabetes education. I had to pass a special exam. I have worked in health departments with kids, adults, and pregnant women who had diabetes. I have worked in managed care, helping people learn how to take care of their diabetes. I most recently worked at the National Office for the American Diabetes Association for more than 11 years. I helped write guidelines and booklets for people with prediabetes and type 2 diabetes. I am lucky enough to still be developing and writing educational materials for them as a consultant. The American Diabetes Association asked me to write this book in 2005 and to update this edition in 2011. The American Diabetes Association has many fine books, but they wanted me to write a book that focuses on the basic stuff, what you really need to know if you've recently been diagnosed with prediabetes or type 2 diabetes. Many people I've worked with through the years have told me, "My life is too busy as it is. Just tell me what I need to do to take care of my diabetes." Well, here it is. If you've recently been diagnosed with prediabetes or type 2 diabetes, you may be scared, or you may have had diabetes for a while but haven't taken care of it. Too much glucose in the blood for a long time can cause diabetes problems. If you've been told you have a diabetes problem, you may be scared too. This book will be helpful whether you've been recently diagnosed or have had diabetes for a while. You may know about the problems that diabetes has caused your family or friends, but you may not have heard the good news about having prediabetes or type 2 diabetes today. You can have a healthy, active, and long life with prediabetes or type 2 diabetes. You can learn to cope with the ups and downs of living with prediabetes or type 2 diabetes. You can take care of yourself by using a meal plan, being active most days of the week, and taking diabetes medicines if needed. If you have prediabetes, you can delay or prevent getting type 2 diabetes. You can delay or prevent long-term problems by caring for your diabetes each day. When it comes to your diabetes care, the experts agree that you're in charge. Sure, you go to the doctor or see a nurse educator every few months, but you choose what and how much to eat. You decide whether you'll take your diabetes medicine, check your blood glucose, and be active. You're in charge, but you're not alone. Lean on your diabetes team for care and support. Who is on your diabetes team? It might be your spouse, your partner, your kids, your parents, your friends, or other members of your family. It might be a neighbor you've known for years. It might be people from your church or synagogue or from where you work. Your diabetes healthcare team can include your doctor, diabetes educator, dietitian, eye doctor, foot doctor, and mental health counselor. Many of the people on your team may also have diabetes. Today, many people in the United States and around the world have diabetes. Almost 26 million children and adults in the United States have diabetes. 79 million more have prediabetes. There's never a vacation from having diabetes or caring for your diabetes. But as millions of people know, you can live a healthy and happy life with it. Turn to the table of contents to start learning how. From the list of chapters, you can choose where to start. You may want to zoom to Chapter 7 to learn more about checking blood glucose. Or you may want to start with Chapter 3 and go on to 4, 5, and 6. They deal with food and diabetes. Or you may just want to start at the beginning and listen through the book. It's your choice. 1. What is prediabetes? Prediabetes is a condition that comes before type 2 diabetes. It means that blood glucose levels are higher than normal, but aren't high enough to be called diabetes. As we become older or less active or gain weight, we are more at risk for prediabetes and type 2 diabetes. People can have prediabetes and not know it. If you have prediabetes, it means you might get type 2 diabetes sometime soon or further down the road. You are more likely to get heart disease or have a stroke. The good news is that you can take steps to delay or prevent type 2 diabetes with weight loss, regular physical activity, such as walking almost every day. A study called the Diabetes Prevention Program showed that these steps helped most people delay or prevent type 2 diabetes. Losing weight and being active worked well for people of all ages. Weight loss can delay or prevent type 2 diabetes. Reaching a healthy weight can help you a lot. If you're overweight, any weight loss, even 10 or 15 pounds, will lower your chances of getting type 2 diabetes. Losing extra weight helped people in the Diabetes Prevention Program delay or prevent type 2 diabetes. People in the study lost an average of 15 pounds in the first year of the study. How did they do it? They ate fewer calories and less fat, and they exercised most days of the week. In fact, many walked about 150 minutes a week. Being active almost every day is another one of the best ways to delay or prevent type 2 diabetes. You can lower your chances of getting type 2 diabetes by adding physical activity to your daily routine. Even if you have heart disease or other problems, you can still be more active. Work with your healthcare team to find out which physical activities are safe for you. As we all know, losing weight and getting active can be hard, and sticking with it can be even harder. The American Diabetes Association suggests an ongoing support group and counseling to help. Diabetes medicines may be added if you're at high risk for getting type 2. It helps to keep track of the progress you're making with eating and walking. Write down everything you eat and drink for a week. Writing things down makes you more aware of what you're eating and helps with weight loss. You can keep track of your walking by wearing a pedometer on your belt. A pedometer is a small device that tells you how many steps you've taken. Or you can keep track of your walking or other activity by writing it down for a week. At the end of the week, total up the minutes you've been active to see how you're doing. If you have prediabetes, you may suspect that someone you love has prediabetes or type 2 diabetes. At their next doctor visit, ask them to get their blood glucose checked if they are 45 or older, under 45 but overweight and have one or more of these risk factors. They have a close family member, like a parent, brother, or sister with diabetes. They are African American, Native American, Asian American, Pacific Islander, Hispanic American, Latino. They've had a baby weighing more than 9 pounds, or they've had gestational diabetes. Gestational diabetes is diabetes first found during pregnancy that is not type 1 or type 2. They have high blood pressure, over 140/90, or are taking a blood pressure medication. They have low HDL cholesterol, the good cholesterol, 35 or lower. They have high triglycerides, 250 or higher. Small steps lead to big rewards. Taking small steps to change the way you eat and increase your activity can delay or prevent type 2 diabetes. Decide how you'll reduce your calories to lose weight. Think about what you're willing and able to do to be more active almost every day. Type 2 diabetes is a serious disease. If you delay or prevent it, you'll enjoy better health in the long run. Feeling good and having energy are keys to living the good life. 2. Type 1 and Type 2 diabetes. What's the difference? There are many types of diabetes, but the two most common are Type 1 and Type 2 diabetes. Diabetes means that your blood glucose is too high. Blood sugar versus blood glucose. You may have heard people talk about their sugar when they talk about diabetes. Your doctor or another member of your diabetes healthcare team may talk to you about blood sugar or blood glucose. Blood sugar and blood glucose are the same. In this book, I'll use blood glucose when talking about the amount of sugar or glucose in your blood. Everyone's blood has some sugar in it because your body needs sugar for energy. Our brain can only work if it has blood glucose. But too much glucose in your blood, too much sugar, can mean you have diabetes. Normally, your body breaks down into glucose and sends it into your bloodstream. Then your pancreas makes a hormone called insulin. Insulin's job is to help get the glucose from the blood into your body cells, where it can be used for energy. Insulin helps keep blood glucose in a normal range. In Type 1 diabetes, the pancreas makes little or no insulin. People with Type 1 diabetes get insulin from a shot or a pump to keep their blood glucose in their target range. Most people with Type 1 diabetes take 2 to 4 shots a day or use an insulin pump. Old names for Type 1 diabetes are juvenile onset diabetes or insulin-dependent diabetes. Type 1 diabetes is not as common as Type 2 diabetes. People with prediabetes or Type 2 diabetes still make insulin, but their pancreas may not be making enough, or their body may not be using it the right way. People with prediabetes or Type 2 diabetes can manage their condition by watching what they eat, by being more active, and sometimes by taking diabetes medicines. Old names for Type 2 diabetes are maturity-onset diabetes or adult-onset diabetes, but now kids are getting Type 2. Type 2 diabetes is the most common type of diabetes. Kids who are overweight and aren't active are more likely to get prediabetes or Type 2 diabetes. So are kids who have a family member with diabetes. Some racial and ethnic groups have a greater risk of getting diabetes. Native Americans, African Americans, Hispanic Americans, Latinos, Asian Americans, and Pacific Islanders. Today, everyone knows someone who has diabetes. It may be a family member, like your mother, your aunt, or your child, or it may be a coworker or good friend. When I worked for the American Diabetes Association, I always carried my American Diabetes Association work bag when I traveled on an airplane. Every single time, someone on the plane would talk to me about diabetes. They talked about their grandchild's diabetes, about their brother's diabetes, or about their own diabetes. Diabetes is serious, and more people are getting it. By taking care of your diabetes and showing others how to do it, you may prevent people you love from getting diabetes. You can be a role model for people around you. People with Type 1 or Type 2 diabetes do some of the same things to care for their diabetes. They watch what they eat. They are active, and they check their blood glucose levels using a meter. But we'll learn more about all of that in later chapters in this book. 3. Eating with prediabetes or Type 2 diabetes. When people find out they have prediabetes or Type 2 diabetes, the first thing they want to know is what they can eat, when they can eat, and how much they can eat. In fact, studies show that people with diabetes find dealing with food the hardest part of their diabetes care. Many people think that having diabetes means they can't eat their favorite foods, but that's just not true. You can still eat the foods you love. By working with your dietitian and by reading this book, you will know how to include your favorite foods and still keep your blood glucose levels on track. For more information on blood glucose goals, see Chapter 8. For most of us, food means more than just getting full. Eating meals brings us together with family and friends. It brings comfort and pleasure. That's why for most people with diabetes, food is the toughest part. There's no doubt about it. Changing the way you eat or the times you eat can be really tough. But keep in mind that you're in charge. You can do it. When you're first told you have prediabetes or type 2 diabetes, you may not be able to meet with a dietitian right away. So what do? There are many ways to take on diabetes meal planning, so let's talk about some of those ways. The first diabetes meal planning method I'll talk about is called Rate Your Plate. Rate your plate. Life isn't easy, and having diabetes isn't easy. But an easy first step in meal planning is to rate your plate. With prediabetes and type 2 diabetes, the amount of food you eat affects your blood glucose. Rate your plate is a method that helps you judge your food portions. In fact, Rate Your Plate gives you portion power. For most people with prediabetes or type 2 diabetes, eating smaller portions makes their blood glucose go down. Here's how Rate Your Plate works. After you've put your food on your plate, take a look. Is about 1/4 of your plate filled with starchy foods such as noodles, rice, corn, peas, or potatoes? Is 1/4 of your plate filled with main dish protein foods like meat, poultry, fish, or meat substitutes such as cheese, eggs, or tofu? Is at least half of your plate filled with cooked or raw vegetables such as salad, or cooked vegetables like carrots, green beans, spinach, or sliced tomatoes? You may also want to add 1 or 2 side foods along with your meal, such as a dinner roll and a small piece of fruit. How does your plate look? What changes do you think you need to make? Do you need to work on including more vegetables or fruit? Do you need to cut back on starches? I'll work on blank this week. Now you know how to rate your plate. Other members of your family who don't have diabetes but want to lose weight might want to rate their plates along with you. Your family is a key part of your diabetes team when it comes to food and meal planning. Lean on them. Ask them for help and support. You may also become a role model for your family and friends by rating your plate and using portion power. Rate Your Plate also works great when you're eating out. Now let's talk about another diabetes meal planning method you can use before you see a dietitian. It's called carbohydrate counting. Carbohydrate counting. We've talked about portion power when you rate your plate. Now we're going to talk about portion power with a focus on carbohydrates. Carbohydrate counting is also called by a shorter name, carb counting. By counting carbohydrates or carbs in the foods you eat, you'll have another way to keep your blood glucose on track. All foods contain the nutrients that your body needs: carbohydrate, protein, and fat. Carbohydrate. Carbohydrate foods can be put into 4 groups. 1. Starches, such as crackers, cereal, corn, bread, rice, and tortillas. 2. Fruits, such as apples, berries, cherries, mangoes, and peaches. 3. Milk products such as milk, yogurt, or buttermilk. 4. Sweets and desserts such as cookies, cake, ice cream, and pastries. Some sugar-free and fat-free foods have carbohydrate too. Protein. Protein foods can be put into 2 groups. 1. Meats, such as beef, pork, fish, or chicken. 2. Meat substitutes, such as beans, cheese, eggs, or tofu. Fat. Fats can be divided into 4 groups. 1. Unsaturated fats are found in canola oil, olive oil, avocado, and nuts like almonds and walnuts. They can protect your heart by lowering your blood cholesterol. 2. Saturated fats are found in high-fat meats, such as hot dogs, sausage, and in high-fat dairy products like cheese, cream, and whole milk. They can raise your blood cholesterol level. 3. Cholesterol is found in foods from animals such as egg yolks, liver, and high-fat meats and high-fat dairy products. Cholesterol in foods raises your blood cholesterol level. 4. Trans fats are found in baked goods made with hydrogenated oil. Trans fats can also raise your cholesterol level. Carbs give you calories and energy, but they also raise your blood glucose more than anything else you eat. Protein and fat give you calories and energy too, but they don't raise your blood glucose. If you need to lose weight, though, using portion power for protein foods and fats will help you. Most people I know are like me. They love carb foods, and many carb foods are healthy foods. Carbs provide good taste, pleasure, energy, vitamins, minerals, and fiber. Even though carbs raise blood glucose more than other foods, it's important for you to have some carbohydrates. For many reasons, then, carbs count. If you get the right balance between the amount of carbs you eat and your insulin or diabetes pills, that will help keep your blood glucose in your target range. The first thing many people ask me is, how many carbs can I eat? For many people, having 3 or 4 carb choices at each meal and 1 or 2 carb choices at snacks is about right. Then round out your lunch or dinner with 1 serving of meat, fish, or poultry, about 3 ounces. Plenty of colorful veggies such as green beans, broccoli, red peppers, or cabbage. Healthy fats like canola or olive oil, nuts, seeds, or avocado. Here is a meal that has 4 carb choices. 3 small corn tortillas, 3 carb choices, with meat, salsa, lettuce, and chopped tomato. 1/3 cup of rice, 1 carb choice. But what about portion sizes for carbs? Portion power with carbs helps keep your blood glucose in your target range. And by keeping your blood glucose levels in your target range, you can prevent or delay diabetes problems. Take a look at the serving size guide. Bread, 1 slice, 1 small tortilla. Starchy side dishes, rice or noodles cooked, 1/3 cup. 1/3 cup spaghetti or rice. Corn, 1/2 cup. 1/2 large ear of corn. Fruit, 1/2 cup or 1 piece. 1 small apple. Milk, 1 cup, 8 ounces. 1 small carton. Sweets, 2-inch square. 1 small piece of cake, unfrosted. Amount to equal 15 grams of carbs. 2 small cookies. Check the food label. Earlier, I mentioned that my mom has diabetes. A few years ago, after Thanksgiving, she was diagnosed with type 2 diabetes. Mama was having severe back problems and wasn't able to be very active. But she and my dad were still enjoying the holidays with more food, which meant more calories. As a result, her weight went up to its highest point ever. As part of a routine checkup, her doctor checked her blood glucose level. Her blood glucose indicated she might have diabetes, so her doctor checked again a week later. Her blood glucose was still too high. Mama was scared when she was diagnosed with diabetes. She was scared because her sister had died from diabetes problems. But she was also surprised. She said she never thought she would have to worry about diabetes, even though diabetes ran in her family. Her doctor signed her up for diabetes education classes at one of the local hospitals. While she was waiting to attend the classes and see a dietitian, she wanted me to be her dietitian. She wanted to get started right away. I told her it would be hard to be her daughter and her dietitian at the same time. She needed her own dietitian. But while she was waiting to see the dietitian, we got started. She and I talked about rate your plate. After rating her own dinner plate, she decided she was eating way too many carbs. Mama loves carbs like I do. Like mother, like daughter, they always say. She also knew she and her doctor had agreed that she'd work on losing 15 pounds. We then talked about carb counting and trying for 3 carb choices at each meal and 1 carb choice for an evening snack. Mama wanted her carb counting to be as simple as possible. She didn't want to be looking things up in a book all the time. Here's what we worked out for her to count as 1 carb choice. 1/2 cup of starchy food such as potatoes, cooked beans, peas, or corn.
Sample complete. Ready to continue?